Well, PURE is a large global prospective cohort study spanning 5 continents of the world, over 150,000 people. And dietary assessments were conducted in participants at baseline, as well as other assessments too, like cardiovascular risk factors, blood markers, lifestyle factors, etc. And people were followed up over time, and currently we have data accrued up to 8 years of follow-up. And so for this particular study, we related the dietary information collected at baseline to the events accrued during follow-up. Okay, what we did is we developed a diet score based on foods associated with a lower risk of cardiovascular disease and mortality. And the foods that we consider as part of the diet score were fruit, vegetables, legumes, nuts, fish, as well as dairy and meats. And what we found was that people who consumed more of these foods had a lower risk of mortality after the 8 years of follow-up. And what it suggests is that the current dietary recommendations, which were developed 2 to 3 decades ago, and largely from data in high-income countries, need to be reconsidered for middle and low-income countries, since the intake of various foods in other parts of the world are different compared to high-income countries. And so it's important to consider the fact that in high-income countries, the major problem is nutrition abundance. So overnutrition, a high intake of certain nutrients and foods, whereas in low and middle income countries, nutrient inadequacy is the problem. And so what it suggests is that from the current data from this particular study, which was conducted in 50 countries, the findings are applicable globally, which is not the case in studies conducted previously in high-income countries, conducted in single geographic regions. So our findings have global implications to improve the overall quality of the diet around the world and reduce the risk of mortality. Well, what it suggests is that by emphasizing the intake of these foods in other parts of the world, both low and middle income countries, suggests that we can make global recommendations to improve the overall quality of the diet and reduce risk for cardiovascular disease and mortality around the world. Well, it's a challenge to identify the perfect diet. I mean, there's not one single study will identify the perfect diet, but what we can do is look for associations in large epidemiological studies and see which foods are associated with a lower risk, and on the basis of that information, construct diet scores. Then we independently validate these scores in other independent cohorts. And this is exactly what we've done. We validated the scores in people with vascular disease, as well as 2 other studies in people with myocardial infarction and stroke, and found similar results to the PURE cohort, which suggests that this is an optimal diet around the world. But as for identifying the perfect diet, I mean, obviously that's going to take independent confirmation in other data sets as well. But we have here what we think is the largest study of its kind up to now, showing consistent results across studies, which reaffirms that this is a high quality diet that could be consumed around the world. Well, with the PURE cohort currently approaching 9 years of follow-up, the plan is to continue follow-up over the next, at least the next 3 years, if not 6 years, and then accrue more events in the cohort so that we can better characterize with higher statistical precision relationships between nutrients and foods and cardiovascular events and mortality, and as well as individual types of cardiovascular events like MI and stroke, and also non-cardiovascular deaths like cancers and, for instance, respiratory disease or other chronic diseases as well. So with the ongoing follow-up, we'll be able to accrue more various different types of events so that we could look for relationships with higher statistical precision in relation to diet and other dietary and other exposures as well in the cohort.